Welcome back to Movement Professional. So today I'm joined by Maddie, my client here, and we're going to talk about an important concept with mobility. The broad concept I want to touch on is what's called closed chain mobility, but we're going to do that today and demonstrate that by looking at Maddie's hip extension and how we can look at improving that. As we do that, we're also going to talk about the concept of like what I frame mobility to be, and we're going to look at her posture, her breath, and then also like the direction that we're actually trying to improve. So when we're looking at something like hip extension, it can also be under the same guise as like, okay, I got tight hip flexors or things like that. And this is so important now when you have any type of back pain, front hip pain, knee pain. A lot of times we want to look at this area because it's very central in the body. So the first thing I'm going to ask Maddie to do is just lie on her side. And this would just be me demonstrating how to look at hip extension in what's called an open chain. So the open chain would be, I'm going to have you bend your knees for me. The open chain would be her foot or anything that would be moving is not fixed to the ground. So we can call it like the most distal segment, the segment that's farthest away from her middle, is not in contact with the ground. So as we get into the closed chain concept, it's going to be the opposite, where we actually want to fix that area to the ground and then move the joint that we're trying to improve around that. So if I'm looking at her hip extension, the first thing I might do is just try to bring this knee back. So I'm passively assessing her hip extension. Now, one of the things I want to look at, and this is going to be really important when we look at the mobilization, is what's she doing up the chain. So let me just have you let your head on your bicep there. So you're just like resting your head down. Perfect. We're just looking for the standard of postures, like the knee, the hip, the shoulder, and the ear are generally in a straight line, or we can think head, rib cage, and pelvis in a straight line. And the biggest compensation you'll tend to see with hip extension is if I pull this knee back, well, theoretically that would be more hip extension if we think about it from that perspective of knee behind the hip. But now what just happened is her pelvis tipped forward a little bit, her lower back arched a little bit, so now she lost this relationship between pelvis and rib cage because her pelvis now is in front of the rib cage and she's actually starting to turn the shoulder down towards the ground. So that's just the reference that I'm looking for. Now for her perspective, I want her to feel, if we're looking for a stretch, the stretch pretty high near the hip crease or the groin because that's where the hip is. So she can get it anywhere down into the knee, she can get it into the front of the thigh, but if I'm having her get it near the hip where she needs it, then that means she would have to be pretty stable in her abdomen here so that this lower back doesn't arch forward like that or the pelvis here doesn't tip down like that. Now, can you feel the difference when I do that, Maddie? Or do you feel that in your back a little bit? Yeah. So, and that's not what we're looking for. We're looking for this area right on the front of the hip. So a lot of times when we're going to be looking at hip extension, we're going to be going the knee behind the body a lot less than we think. Because as soon as we start to go back that way, we're going to often lose this posture. All right, so another thing I can look at from this perspective would be how easy is it once I get her stacked in this position to get that knee towards the ground, right? So if the knee comes down towards the ground, which adducts and internally rotates the hip, that also gives me an assessment of how her pelvis wants to move here and how it frees up. Does that hurt at all? Does it pinch anywhere when I do that? No. Okay, but the knee doesn't come all the way to the ground. So if that happens really easily, then we know, okay, that's pretty free here. But most of the time, people are going to be limited here. So this would just be part of the assessment. This is also part of demonstrating this would be more along the lines of like an open chain hip extension. Now, the reason that this exercise wouldn't be great for her to do is because let me ask you to try to recreate what I was just doing there on your own. And what tends to happen is it's very hard for her to control because she doesn't have a lot of reference for what's going on. So she's going to start to want to turn forward here. She's going to have a hard time getting the hip back and the knee down at the same time without the pelvis opening. There's just no reference for her to have contact or feedback for anything because just too many things are hanging out in space. And there's a way that we could teach it that she can kind of feel some of the things she wants to feel, but a lot of times she's also not going to get enough direction to where she wants it or not enough force to actually guide her where she's limited. So putting her on her side in the position that I'm assessing isn't usually going to be the best exercise to actually help her get more mobile. So one of the things that I can have her do then is let's come up to kneeling. Okay. So if we're kneeling, we're just going to have you we'll do this left side again, put your right foot forward and your left foot back. So now if we're in this position, we've closed the chain. We've taken the knee and the foot and we've anchored them into the ground. So now our focus again is on posture, ear, shoulder, hip, or head, rib cage, pelvis in alignment there. So what I want you to do is I want you to cheat a little bit, and I just want you to try to drop your hip to the ground as far as you can into that position. All right, so then we can see what happens here is, again, there's this compression that happens on the lower back here. All right, and now where do you feel a stretch when you do that? Kind of up through there. So she's still going to get the stretch, and this is one of the reasons that we don't want to look at building mobility as necessarily finding a stretch, but we want to look at it as understanding position, posture, and then direction, and then we can add breath to that to help guide us a little bit farther. So what I want you to do this time is we keep this reference of head, shoulder, hips, tighten your stomach, and you're going to think about taking your hips and just tucking them under a little bit. And now what's really important as you come forward is you want to feel the stretch high into the hip crease, but also something on the back side here, your butt, your hamstring, that should stay active, like you're squeezing that area as you come forward. And you shouldn't be able to come as far forward, but it should feel a bit different to you. All right, now where do you feel that as you go forward? A little bit higher up, yep. And then on the back side here, you can see that there's some muscle activation, high hamstring, and the buttocks, where those are the two areas of hip extensors. So we're trying to stretch her hip flexors, but we're trying to move her into hip extension. So we want the muscles that do hip extension to be active to guide her in that right direction. So there we can add a breath into the mix now. So when you breathe in, I want you to think about trying to like make your thigh a little bit longer and tighten your butt a little bit more. As you exhale, breathe out, try to tighten your stomach muscles a little bit more. The whole time you're just thinking about like guiding yourself a little bit more forward from everywhere. So the shoulders move forward, the head moves forward. So now the postural line is head, shoulder, hip, but it's sort of at this diagonal as we move forward. So we don't want the back to arch, we just sort of move everything forward. But the key is that you're using the breath to help guide these muscle contractions. All right, so the inhale, you can think of it as like you kick your shin harder into the ground. That'll tighten your butt more. And then the exhale, it goes more to the abs or this sense of even like sucking the knee towards the hip, which you might get a little bit more inner thigh. So now we get all this like muscle activation, and all of that guides you to the direction of hip extension, and then you can come out of that. All right, that feel a little bit of work?
Yeah.
So it should feel like work. It should feel like you're being pretty active in this process. It's not just about stretching, although I'm sure you got like a stretch in the front, but it's a very guided and directed stretch. And when you're done, you should feel like you did a little work, like you got actually stronger in the angle of the position. Now where the closed chain concept comes into play again is you had your knee, your foot on the ground, so you have this reference to push into something, to hold you still so that the leg isn't moving all over the place. And that gives you a better sense of saying, okay, I'm holding my posture where I want to, where if there's more things that are not in contact with the ground, it's really hard to know where you are in space. Make sense?
Yeah.
Did great.